Hello everyone, I'm Dr. Shynie and Telmo, Master in Public Administration, Mindoro State University. I'll be discussing about community awareness and policies on rabies control and prevention in selected barangays of Oriental Mindoro, basis for implementation strategies. To give an overview about the disease, rabies is a fatal neurological viral disease infecting all warm-blooded animals and humans. It is a classic disease in a community-based problem. Um, Rabies is 100% fatal or almost always fatal, but it's also 100% preventable by vaccines. Dogs are recognized as the most common source of infections in humans through bites and through their saliva. In 2018, an estimated of 59,000 human deaths worldwide was tallied, and most of it came from Asia and Africa. In the Philippines, 200 to 300 Filipinos die because of rabies per year. There's already an existing law for rabies, the Republic Act number 9482, which is the Anti-Rabies Act of 2007, and under which is the National Rabies Prevention and Control Program, which aims for a rabies-free Philippines by 2030. For the conceptual framework of this study, to assess the extent of community awareness, three types of communities were considered. Community with confirmed animal rabies case, without confirmed animal rabies case, and indigenous community. To know the extent of implementation of community policies, prevention activities, control, and advocacy were considered. For the respondents, there were two types of respondents, the implementer or the barangay officials and barangay health workers, and the community, which was present or represented by the pet owners. So from here would be the proposal implementation strategy and any issues and concerns that will be gathered during the interview would be raised for immediate action. For the methods, 15 municipalities of Oriental Mindoro was chosen to be the research locale of the study. 174 respondents is the total of respondents in the study, and data were gathered through interview using questionnaires. In answering the questions, a numerical scale of 1 to 4 was used, with 1 being the least extent and 4 being the great extent of awareness. In assessing the knowledge on rabies prevention, questions focused on first aid responses, rabies prevention activities, and management of biting animals. For the control, questions focused on mass vaccinations, animal population control, and local ordinances. And for advocacy, the respondents were asked about their commitment to sustain and have long-term advocacy to rabies eradication. In terms of the correlation between rabies community awareness and policies in Oriental Mindoro, there is no significant relationship between community awareness and policies for communities with confirmed rabies cases. And there is a significant relationship between community awareness and policies for communities without confirmed rabies cases. And for communities with indigenous people, there is no significant relationship between community awareness and rabies control and advocacy, but with a significant relationship between community awareness and rabies prevention. Some implementing strategies that were recommended are the following: in-depth seminars and training for barangay officials and BHWs, proper pet management, dog registration at the barangay level, strict enforcement of penalties and fines under RA 9482 at the barangay level, allocation of funds for the implementation of the law, barangay or municipal animal shelter and pound facility, display of tarpaulin in common areas in the barangay, announcement of scheduled mass vaccinations, and proper waste segregation and disposal to avoid attracting stray animals. For the issues and concerns, some that were raised are the variable guidelines of municipalities on free human vaccines or shots, municipalities without animal bite treatment center, lack of dog catching facilities and animal shelter or pound, and presence of traditional healers, especially in the indigenous communities. And that's all for the discussion of this particular study. Thank you so much for listening.